Hello, everybody. Dr. Troy here, Vancouver, Washington, Maximize Living Doctor. Here with Kristen Kells. She's also a Maximize Living Doctor from Colorado Springs. And you were one of our presenters at our conference here, Maximize Living, and so I just kind of wanted to ask you a few questions just to share with people, people who are listening on the radio, the TV, any of your patients, any of my patients. I just want them to just kind of hear about what's happening in Colorado Springs, not just Vancouver, Washington, but just across the country. We've been working with the Olympics. You've been working with some of the wrestlers for the Olympic team, and I know a little bit about your history. About coming from like a personal injury practice, and where a lot of people just thought chiropractors do things to your back to help you recover from a car accident. But after this weekend, it's so much bigger than that. And you just got off stage speaking, and we all have trials and tribulations. But if there was somebody who is suffering and who really needed some help, what would you tell them to do? I mean, that's a loaded gun.
That's a long question, Dr. Troy. It's really overwhelming, first of all, being here. I mean, we're here with 1,000+ doctors all across North America, as far away as Australia. Really, we're a movement. I mean, we're individual doctors that train, that study at the highest level, highest caliber. But there's so many of us, it's almost overwhelming. I mean, I had goosebumps all afternoon looking at the movement. And so our primary mission, of course, is to change people's lives, people that are suffering, people that don't know how to get better, people that don't know where to turn. And so my number one thing to that question, my number one thing is find a Maximize Living chiropractor.
Yeah.
If you want somebody to coach you and help you and give you answers back to health, that's the first thing. And we've got so many doctors right now that we can send people to. And so that kind of answered it. But I want to touch on one thing that Dr. Troy talked about, is that I was the kind of chiropractor that really focused on short-term pain. And what was a huge moment for me is I woke up one day in practice and I realized that nobody's life was being changed.
Yeah, that's the day you really go, wow.
That was the day that I changed my life.
And you probably had a little bit of that today too. Like,
I did.
I'm not doing enough to just serve our community and save lives.
I did. I mean, it's about the people. It's about you guys out there listening that you've lost your way in terms of your health. And so for me, it was, waking up and going, what more can I do? What about the children? What about all the kids that are taking medications? People that are listening, 1 in 4 kids in this country are on chronic daily medications with no hope of getting off. Tell me how that can be okay, that 25% of our kids in this country are medicated.
Yeah, I mean, it's not okay. And that's what gets me up I tell patients, what gets me up every day is saving families.
Yeah.
Just like when I'm in front of people, I'm like, that's what gets me out of bed.
Yeah.
And that's the only thing that gets me out of bed is going to office and saving lives.
Yeah, it is. And you guys that are patients of Dr. Troy's, if you see this, you have no idea how blessed you are. I mean, we send people from all over the world to this guy right here, and so you're blessed. You've got one of the top chiropractors in the world working with you.
So what's really fascinating is this whole Olympic thing that's been developing, and you are right next door to the Olympic Training Center, and so you're now seeing some of the athletes come in. Lee, we interviewed her recently, and I'm not. Are you working on Henry?
I'm not. He actually is not in the Springs right now.
Oh, okay, okay. So he's not there. Okay, so Henry's
Dr. Emmett is working with the gold medalist.
Wow, awesome. So, and he's headed up the wellness council for us for the Olympics, which is amazing. So maybe you want to just talk about that a little bit. How you got involved? What kind of things are happening? What can people expect?
Well, it's been really fun being on the kind of the grassroots level of this movement, where the athletes came to us and we started developing a relationship, and they said, we need a high level of chiropractic care. We don't need just somebody that doesn't know our bodies. We want somebody that's done a full analysis. And that's really probably Lee's story that she shared with you.
Yeah, amazing story.
Yeah. Yeah, and athletes.
And then you helped her like with her sinus problems.
Yeah.
She was talking about how she couldn't be, her abs were, she was like kind of, I don't want to say fat. How do you tell?
She couldn't build her abs up.
Yeah, she couldn't build her abs.
That's the nice way.
And now she's recovering really quickly. And she said it was amazing after you worked on her with the techniques that we're learning.
Yeah.
And I don't know if you want to comment on that. She was fired up. I mean, I interviewed her earlier, and she was fired up about, Kristen Kells, Colorado Springs, Olympic, and she loves Maximize Living. And, I know she would send her grandma to me or any Maximize Living doctor.
Yeah.
So maybe you just want to talk about that a little bit.
Well, it's tough to kind of blow your own horn, but when you study and train and develop skills to really strive to be at the highest level of your profession, you're able to offer something. And so with her, she'd been to chiropractors before. It's not like this was her first experience at a chiropractic office. It was just that much difference when you use really specific ways of analyzing, developing your technique, working on a patient's body. You know, it's kind of, I like to say it's a difference between going like this and trying to hit the bullseye versus knowing exactly where the bullseye is. That's the difference. And you know that when you do a workup on an initial patient, how long do you spend studying all that information? A long time.
Yeah, I mean, and one of the speakers, Dr. Ben, said from the stage, you know, who says, you know, everybody's coming to us because we have the answers.
Yeah.
And so what are some of the conditions, maybe like 4 or 5 conditions that you've heard or you've seen change in people's lives that maybe, you know, they've been down the medical, I call it the medical merry-go-round, but they've lost hope in the traditional ways.
Sure.
And maybe just, you know, a couple different conditions, or 5 or 10, or if there's people out there who are suffering from these that are praying for an answer, for somebody just to turn their life back on.
Sure.
What are some of those things?
I can think of probably 10 in the last day.
Well, I mean, we could talk all day about this, but you know, if there's people that are just tuned in and heard this, what things are out there that you would say, take action now?
Well, immune system disorders for sure. Cancer, heart disease, diabetes, asthma, allergies, those are some of the top ones that I can think of just off the top of my head in my office. You know, what I think of as the classic patient is somebody saying, I've been on this medication for a long time, I don't want to continue taking it, and what do I do? Yeah,
somebody who wants to make change. I mean, you know, the hardest patient is the one that doesn't want to do anything different.
Yeah, those are just off the top of my head. With kids, we see so many learning disabilities, autism. We're starting to develop a whole protocol to work with those children that are really struggling.
Yeah.
And a lot of parents don't know what to do.
Yeah.
They don't want their kids on Ritalin. They don't want their kids on medications, but they don't know what else to do.
Yeah, that's the only thing that's out there, really, unless they step into one of our offices. So
You bet.
So thank you so much for sharing, Kristen. Appreciate you.
I love you.
Love you too. And thanks for all that you do. And if you're in Colorado Springs, Kristen Kells, check her out. Thank you, Dr. Kells.
Thanks, everybody.